Good afternoon. Thank you for the opportunity to testify at today's hearing. My name is Carlyn Cowen, pronouns they and she, and I'm testifying on behalf of the Chinese American Planning Council, CPC, today. I'm going to start with a personal story. When I was 11, my mom got sick, couldn't get out of bed sick. She had to go on disability, and it took years of doctor's visits, PT, and more before she could do simple things like walk or change her position unassisted. My dad and I had to figure out care for her, my chronically ill younger brother, and the household, while of course still managing work and school. I tell this story because we all have a care story here today, and if you don't have one right now, you probably will. 7 out of 10 of us are going to need long-term care at some point in our lives, and it's often earlier than we think. New York State is aging rapidly. By 2030, 5.2 million people in the state will be 60 or older, not to mention more than 1 million disabled New Yorkers that need care to live in their homes with dignity. The good news is that New York State is constitutionally mandated to provide these services to all New Yorkers because of the U.S. Supreme Court Olmstead decision. The bad news is that the state severely underfunds the nonprofit organizations and workers they outsource these services to, and New York is now the epicenter of the home care workforce shortage crisis, with a projected workforce shortage of 83,000 workers by 2025. The cause of this workforce shortage is chronic low wages and poor working conditions pervasive throughout the sector, a direct result of state funding decisions. According to the New York State Department of Labor, the median annual salary for home care aides is $24,800. The low wages chronic to the sector are deeply rooted and directly connected to the systemic devaluation of care work as work that is traditionally performed by women, historically enslaved Black women in the United States. Today, the home care workforce in New York State is 90% women, 75% people of color, 67% immigrant, and the state continues to enshrine the devaluation of care work in its programs, practices, and reimbursement rates. CPC, as well as its affiliated home care organization, CPC Home Attendant Program, or CPC HAP, have 4 core recommendations to reform the home care sector and build a just and caring New York. CPC has been advocating on these issues since 2017. Number 1, end the Department of Labor 24-hour rule. One of the most urgent issues in the home care sector is the 24-hour rule, where home care workers are assigned 24-hour live-in shifts and are paid for 13 hours of work, with 8 hours allocated for sleep and 3 for meals. This is based on a Department of Labor rule that was upheld in a 2018 Court of Appeals decision. CPC believes that no worker should have to be away from their home for 24-hour shifts, and that workers should be paid for all hours they work. The state must immediately end the 24-hour rule in favor of 12-hour split shifts, where home care workers are fully compensated for each hour worked, which can only be accomplished through passing A 3145, Assemblymember Epstein's bill, S 359, Senator Persaud's bill. This will cost $1 billion a year, which is a fraction of the New York State's $212 billion budget. Nonprofit home care organizations like CPC HAP are 100% Medicaid funded, required to comply with all of their state contractual, legal, and union agreements, and must provide the type and hours of care assigned to each client by Medicaid. They cannot simply drop existing 24-hour cases due to the patient's Bill of Rights. CPC HAP and many other nonprofits have stopped accepting 24-hour cases and strongly seek authorization for 12-hour split shifts for existing cases, but are more often than not denied by the state. This neither solves the problem for workers who must work these shifts or people that need round-the-clock care. This is why the system was changed to make 12-hour split shifts the standard instead of a rare exception. Number 2, pass fair pay for home care, S 5375, A 6329. Fair pay for home care would raise home care worker pay to 150% of the highest regional minimum wage across the state, allowing workers to remain in rewarding critical care jobs instead of making impossible decisions about moving to higher wage jobs in different fields. It would also wipe out the home care workforce shortage in less than 5 years, creating 20,000 additional jobs per year for the next decade, according to a recent report. Number 3, remove the arbitrary spending cap on Medicaid and fully fund Medicaid to meet the needs of more than 1/3 of New Yorkers that rely on it. Rather than removing the spending cap, the governor chose to cut $1 billion in Medicaid funding in the middle of a global pandemic. Rather than remove the spending cap, the governor has chosen to depress home care wages through reimbursement rates and cause a workforce shortage crisis. By removing it, we can both fully fund our home care workers and the people that need care. And number 4, last but absolutely not least, pass the New York Health Act and guarantee universal long-term care for day one for all New Yorkers. New York State has rationed care for far too long, prioritizing government austerity and private profits over our quality of life and dignity. As a result, workers have suffered, older adults have suffered, and disabled New Yorkers have suffered, disproportionately women, people of color, immigrants, and low-income New Yorkers. But it doesn't have to be this way. New York has the resources to fully fund Medicaid and long-term care services to meet their growing need, and its constitutional obligation to provide for it. We don't have to choose. We can and we must build a robust long-term care system with good jobs where workers can thrive, and seniors, disabled New Yorkers, and every one of us who needs home care can receive the full care that we need in our homes with dignity. Thank you.
Do you want to ask any questions? Senator Ramos has to leave at 4 o'clock, and she was specifically asked if we could
I
go.
apologize. I just, I wanted to kind of see the whole of the issue. And I agree. I mean, a big part of the conundrum of this money, especially for a not-for-profit organizations and not our for-profit agencies, right, is the fact that, the big guy on the second floor just insists on chipping away at the money that we need in order to care for each other. So I'm wondering, is there anything else aside from that we can help, that we can do to help not-for-profits achieve the solvency they need in order to do the right thing for the workers? And I'm wondering if your organization has an idea of how many of your home attendants are impacted by this 13-hour rule, 24-hour shift.
Absolutely. So CPC HAP, which is an affiliated organization, I'm at CPC, the Social Services Agency, just to clarify, has 54 24-hour cases that are staffed by about 130 workers. There are about 11,000 cases across New York State, staffed by about 33,000 workers. So while it is, a small portion of home care across the state, it's still a very urgent issue because, as you heard from the previous testimonies, we have workers working under these conditions that they shouldn't be, and in homes for 24 hours without getting compensated for all the hours of their labor. So nonprofit home care agencies like CPC HAP, as I mentioned, are 100% Medicare funded, which means all of the funding is tied to Medicaid rules and reimbursements, and then of course they're subject to union agreements, Department of Labor laws, et cetera. CPC has been advocating. First, we were actually advocating when the court cases were going through, the Court of Appeals decision that I mentioned, for the state to pay back wages for the workers to make up for the gap between the 13 hours that Medicaid pays for the time in home and then the remaining hours that Medicaid calls sleep and break mealtime hours and doesn't pay for. So at CPC HAP, if a worker gets interrupted at the first recorded interruption, CPC HAP pays out the full hours for between the 13 and the 24, but that's not the standard across the industry, and I think that those are some of the problems that you heard about in the previous panel, and the only way to make it a standard across the industry is to have it standardized across Medicaid rates. So we were initially advocating for the state to fund back wages, which would have cost $6 billion. The Court of Appeals decision essentially meant that the state was upholding its own Department of Labor law. And so since then, we've been pushing on the A3145, which is the bill to end the 24-hour rule. That would solve the issue going forward, but of course, it would not deal with retroactive compensation. I think that I'm not a legal scholar, I'm a humble advocate, but I think that there's a very difficult path legally to what that would look like based on the Court of Appeals decision, but I think there are a lot of people that are more expert than me on that. But that's why we're really focusing our efforts on moving forward, ending the 24-hour rule, and increasing wages for home care workers.